Hey everyone, I'm Neeta Mitchell, RN. This is Dr. Matthew Rutman.
Right.
We're the husband and wife team behind Balanced Health and Wellness here on Long Island. We are a physician led aesthetic and wellness practice. We focus on hormones, longevity, metabolic health, and natural facial balancing. Our aim is to help our clients find energy, confidence, and balance from the inside out. Today, we are so excited to be sitting here next to someone who embodies resilience, reinvention, confidence, and strength. We are so excited. Teresa Giudice, welcome.
Thank you. How are you?
Good, thank you.
Thanks for having me.
Welcome,
My
Teresa.
pleasure.
How are you? How was the flight out?
It was great.
Thank you again for coming in today. We're really excited to sit down and talk with you. Today is really about wellness with a little bit of beauty mixed in. We'd love to pick your brain and
Okay.
understand the mindset of someone who lives such a public life and hopefully get a few tips and tricks along the way.
Okay.
So, to get started,
I love this.
Good,
Yeah.
good.
Let's
We-
get started.
good. We love your energy.
Yeah.
Is that espresso or is it more discipline, good genes, or are we talking like what supplements, peptides? What's your daily stack or routine look like?
No, I mean, this is actually me. I mean, yeah, I did have a coffee today, but I do wake up happy every day, thank God. And I do have, good energy. But I know everyone's talking about peptides nowadays, and I know they're working because I know a lot of people that say they're on them, and I'm like, all right, so I want to jump on the bandwagon and try some. But it's like I don't know who to go to. You have to go to the right people.
Right.
So
And that's an excellent point. I think going to a physician is important because they have a background in medicine and they can deal with whether side effects, and they can look more into what's bothering you. What's physically ailing you along the way. What do you think if you can level up in your life? Um, this year, what would it be? What would you want to improve in your life?
I guess I mean I do have a lot of energy, but it doesn't hurt to have even more energy. And I was just talking to your wife before, and she was for skin. Skin is great, and for the gut health.
Yeah, so important.
The gut health, skin, and I would say energy.
Energy.
Yeah, I mean,
So two things just right off the bat, I think we could talk about with you. That would be ideal. NAV is not a peptide, but it's a natural substance in our body that helps make ATP, which is the energy source of our cell. If you take NAD as like a shot every other day, it will provide you with tremendous amounts of energy. Longevity wise,
I heard about NAD.
it helps your cells
I just
restore themselves.
ordered them on Amazon, NAD supplements.
Supplements,
So I don't know
pills.
if they're going to work, but I just got them.
Yeah,
So
that's a great start. And then what my wife was talking about is Glow. Something like Glow has three peptides. It has copper in it, something called GHKCU, which helps with skin tightening and collagen formation and hair growth and nail improvement.
like that.
And then it has something called BPC 157, which is a natural peptide in your gut. And it helps with gut health, which helps with your immune system, your brain health. And it helps with something called angiogenesis. It makes blood flow to your joints. So if you're achy after a workout, something like that, it'll improve that. You'll feel fantastic on something like that.
Yeah, and I do work out a lot. So if I take a few days off and then when you start to
Yeah,
work out again, then you get a little achy. So that would help with
It's a
that.
great combo.
Ideal for you. So Glow and NAD, I think would be really, really
I
good
like
for
the
you.
name of it, Glow.
Glow is perfect.
Who doesn't
yes.
want to glow?
Yeah,
Yeah.
you're glowing already. You don't need
Yes.
much. So
It'll only enhance it.
Thank
Yeah.
you. Thank you.
Yeah.
And so this is a physician-led office wellness center. What like if you came into a place like this by you, what would you ask for first? What else would you look for?
What I just said. Yeah,
Just
let's
about
anything that I would want to, feel good, look good.
Yeah.
And I mean, I don't know what else do you have here.
Yeah. So another thing like you were talking about, there's something called peptides that make your body naturally release growth hormone, and as we age, our growth hormone goes down. So with that, it will things like tesamorelin or ipamorelin or sermorelin. What they do is it helps your body improve muscle mass. It decreases visceral fat, which visceral fat lines your organs, so that's
Yeah.
healthy.
Hard to get rid of.
And it gives you better sleep,
I-
energy. So
I have tried. I think what's it called?
tesamorelin.
Yes.
Yeah.
I have tried that.
Yeah.
But not for a long time. So I don't know if maybe it did stuff for me that I didn't see. And also was on testosterone.
Yeah, which we'll get to. We'll get to in a couple
Okay.
seconds, but I'll let you ask a couple questions, and then we'll get into the hormone replacement.
So we're always curious because you're busy, you're filming, you travel, you have appearances everywhere. Um, how do you realistically stay consistent with your wellness routine, whether it be beauty treatments that you get done? How do you focus? You're everywhere, right? You're always probably traveling a lot.
I mean, when I was doing like the testosterone shot, it was only once a week. So
So it's
that was not,
convenient.
yeah, so that was pretty easy. And if I travel, if I miss a week, then I miss a week. What are you going to do? Is that a bad thing to miss a week?
Well, it is because once you start, like if you're doing shots, and that'll lead me to what we were talking
Okay.
before this interview, Teresa and I. But if you miss a shot, your levels will drop down. So unfortunately, you'll be more fatigued. Your sex drive may go down. So your energy, your mental clarity may go down. So that's why here at Balance Health and Wellness, we do pellets. We do a bioidentical hormone replacement. We actually surgically implant them in our patients. For women, it's wonderful because you have 4 months of testosterone and estrogen if you're estradiol, if you're postmenopausal, and you don't have to worry about anything. There's no worry about traveling. There's no worry about ebbs and flows of your levels. You just have a constant flow of testosterone. So it's like a wonderful thing. And how do you feel about, like, I mean, 15 years ago, nobody ever talked about hormones. Do you feel comfortable talking about it in the public by doing it?
Yes.
You don't
Oh,
mind at all?
no, not at all.
That's good.
Because it's part of life. And that's the thing, like
Awesome.
back in the day, I guess nobody really talked about hormones. Or people talk about like premenopausal and
Yeah.
menopause and all that.
They
But there's
hid
like
it.
so many, yeah, and they hit it.
Yes.
Yeah, like
It was a
nowadays,
secret.
everyone talks about it even
Yeah.
more openly. And I feel like everyone looks better now because they're on peptides
Yeah.
and
Absolutely.
and
And they're balancing their
just-
hormones.
exactly.
So
I was
that
gonna say balance, health,
Yeah.
yeah,
Yeah,
wellness.
I'm actually 84, so pretty
Yeah,
well.
okay.
Not bad. Yeah,
But my husband does the pellets and he loves
he
it.
does. So
Yeah, he loves
So
it.
you're gonna we're gonna this is this might be a earth shattering thing, but she's gonna come to me and do pellets. I think in the
Yes,
future.
yeah, so
She's gonna take a trip out 3 times a year to Long
I
Island
know.
on her way to the Hamptons and hang out with us for a day.
Oh, it's just
So
Yeah.
yeah.
will make you even more glowy and happy and energized.
yeah, no, I haven't done that route yet, but
Yeah.
never
I
say
think
never.
I like it for the fact that I just started it myself and I like the convenience of it. I like the safety of it with the shots. There are a few risk factors that I do not like with it. So it's the convenience. It's a 10-minute procedure, nothing that's long lasting. The little incision that's made there heals very quickly. And it's consistency with my levels. So for me, it just makes that much of a difference where I feel it all the
I
time.
just heard like, I don't know, maybe now it's come a long way. Like, is there any weight loss? I mean, like,
Weight gain.
or weight gain, sorry, if there's any weight gain, because like if you're not on the right level.
Yeah, listen, there are always risk factors with anything. I mean, testosterone can definitely lead to things like acne and facial hair in women and a little bit of bloating. But, if done properly, and again, nothing's foolproof, but if done properly, levels checked, discussions with the patient about prior histories of acne and things like that, what we do here is we start slow and low.
Customize it.
And if you
right,
don't
based on
feel
your
enough, then we go up. And as long as we're not getting any of those bloating side effects or anything else. And the great thing about coming here is I'm very available to patients, as is my wife. And if you have a problem with something, we can correct it. We have all the solutions for, let's say you get bloated, we could potentially put you on like a diuretic. We can block the testosterone level for, a little bit of time. We put you on something called DIM, which helps block, too much estrogen from forming. So you don't get moody, things like that. So
I was taking DIM as
DIM.
a supplement.
Yes, which is great.
Which is good.
Yeah, it'll keep your good testosterone
Definitely
around.
good.
It'll keep you from, most people don't realize there are 3 types of estradiol or estrogen. A couple of them lead to breast cancer, which obviously we don't want. And the good one, we can kind of stimulate more. So you need that as we get older. Bone density is extremely important. Mood is important. Sleep is important. All those things can be controlled with hormone replacement. Why not feel more youthful? Why not turn back the clock? And that's what people used to, yeah, right? That's the key. And hormone replacement, I think, is a global fix. Not a fix, but a global improvement. Instead of doing like Band-Aid here, Band-Aid there, your joints hurt, this hurts. Why not take it for your brain health, for your, kind of physical bone density improvements?
Lost libido.
Yep.
So
Even
important.
even there's studies that show that your cardiovascular improvements with hormone replacement are done in the proper time frame. So within 5 to 10 years, or 6 to 10 years of menopause, it improves the elasticity of the vessel. So it's a really wonderful thing. I think it's just all great. And, occasionally we do have some bloating and stuff, but we can fix that. I mean, that's an easy fix.
Yeah.
I think
Yeah.
that the rewards way outrisk any that.
And I
way
think,
risk.
in regards to the bloating or gaining weight, I think once the hormone levels get balanced, it makes it a lot easier for our clients to start focusing more on their weight loss because that now becomes easier to manage when the hormones are balanced. So a lot of times it's a struggle. They're trying, even with the weight loss meds, they're on it and it's just not working right for them. It's because the core of the problem's still not right. The hormones are just not where it should be. So it makes it even more challenging to have the weight loss meds work better, or they're exercising and dieting and everything else. So I think it's just the core of helping everything else work better when you have your hormones replaced.
Yeah.
Yeah.
No, and I see like everyone's looking a lot better, younger, which
They
is
are, right?
yeah, like
I
if it's
mean, yeah, I definitely think
compared
it's gonna
to,
change the
you know,
future.
Here, what we try to do is ask our patients not again, like not put a Band-Aid on things, not give medicine just to prevent, we like to prevent things from happening, but
Yeah.
I always go through a list of, are you having trouble with, your sex drive? Are you having trouble are you having trouble, focusing? Whatever it is, sleeping, anxiety, whatever it is, your bones are hurting. We go through a whole list of, possible problems, and we can offer a host of, whether it's just, improving your vitamin D or improving, a peptide that will help with a certain aspect of your life. So that's what we try to do here. And we try to cater it, and we use it, do it in a safe fashion, obviously. So peptides are underutilized. You're totally right. I mean, the only reason why they're underutilized is because Big Pharma doesn't want to spend the money on, researching them. But they have tremendous benefits in our society. They're amazing. So they're only going to come to the forefront now, and you're going to be a hold of all of them. So
You're in incredible shape. If you can give us some pointers, like what is your discipline? How often do you work out? Do you have a personal trainer? For a lot of us that are struggling, trying to get it
I do
together.
work out. I do have a trainer. She comes to my house.
Okay, that's awesome.
I would say like 3 times a week.
Okay.
I see her. Not always, it
Yeah.
depends on my schedule.
Travel, yeah.
And like she texts me at the beginning of the week, when am I seeing you this week? And then I'll tell her which days I'm available. And then now I don't have all the machines in my gym at home, like for instance, like leg machines. So I go to Lifetime
Okay.
like the other 2 days.
Okay.
So
You make it happen.
yeah. So and then I take like maybe 2 days off,
Okay.
like on usually Saturday, Sunday, on the
Yeah.
weekends.
It's great.
Yeah.
yeah, I promote muscle mass building to all my patients. So, I mean, you're going to just live longer if you're building muscle. It's perfect. It's great you're doing that. So,
Yeah, you have to.
Yeah.
absolutely.
Definitely.
I'm sure when you miss a day, you probably get annoyed with yourself.
I mean, that sometimes now, yeah. It depends, It depends what happened the night before.
Right.
But yeah, no, it makes me feel better, obviously, when I go to the gym.
Yeah. And we're seeing more and more that working out, exercising, muscle toning is just so much more beneficial for women with brain health, with Alzheimer's, with cardiovascular disease. So it's just so important to do. It's just so hard to get to sometimes.
Do you take any supplements? Do you like creatine or anything like that? Or
No, I don't.
nothing?
I take like I do take supplements. Like I take a vitamin D. I take magnesium. I take for hair growth. And then there's other names like DIM,
Yeah.
and like these other ones. I don't know the names of them right now. Yeah, so I do take them.
That's awesome. It's very good.
Not,
It's important.
listen, not religiously. There's
Yeah.
if I'm traveling sometimes, but sometimes I bring them with me. I put them in a Ziploc bag and I just bring them with me.
But you have us beat because we have, 3 daughters. You have 4. I have no idea how you booked this, but and raised 4 daughters. That's impressive, by the way,
Yeah.
because 3 is impossible right now. So
Yes. They're
yeah.
so mouthy.
Yeah. My youngest is 16. Yeah.
Okay.
Like my middle one, middle child syndrome. Like
Yeah. They go through that rough period.
yeah.
But then they come out of it really.
I love my girls. I know I have 2 stepsons, but I love having girls because that's what I had.
Yeah.
And I love it. I wouldn't have it any other way.
Great. It's awesome. We love them too.
we do. The boys are just easier.
This
You know what? I have stepsons and they are very easy. And everyone says boys are so much easier than girls.
Yeah.
And I guess I don't know because
You had
I only
girls.
had girls.
Yeah.
But like my stepsons are very easy.
Well,
Yeah.
my 10-year-old makes me dessert every night, so it's really hard to stay in shape with her around. She's fantastic,
You
but she
can't
wants
say
to
no.
she wants to make me chocolate covered strawberries every day or some form of dessert. It's
Yes.
impossible to kind of
Oh,
stay
that's
completely with her.
cute.
It's adorable.
Yeah.
So,
And we must eat it.
yes, we have to,
Always.
regardless. Or
So
she'll make a
so she likes baking.
She likes everything.
Yeah.
She likes talking. She
I
loves
think it's
talking.
her way of making up time with us because we're here so much. So when we get home, it's about 9:30, 10 o'clock. So she finds a way that she could pull us in and spend a few extra moments
Oh,
with us
that's
before it's
cute.
bedtime. Yeah. So she makes us eat lots of sugar and
Oh, you get
chocolate.
to hear a lot
Yeah.
of hours.
Yeah. Yeah.
It's been very hands-on with your patients.
We are.
Yeah.
That's good.
Yes, we love to be. That's
That's
what, like he
important.
said, yeah, he's always accessible. Our patients can reach us at any time.
Yeah.
We just always want, it's a family. We
Yeah.
literally, like we say that in our motto, our logo, but it's, we're truly family oriented.
No, that's
in our
important.
set.
Wow, because you don't really find that a lot, so
No.
that's really important.
So a little bit of beauty talk. So there's so much noise on social media about beauty treatments, and some we love, some are a little bit extreme. I have a lot of my clients who are coming to me a little bit older and they're nervous. They're nervous about doing fillers and Botox and lasers. So I'm always trying to educate them that, safety always first, but going to someone who knows what they're doing, who's confident, who can educate
Right.
them is such a good thing, right? They should always go to someone who's there, who has their best interest. So for you, what would you say to women who are scared, who are nervous about not only looking good on the inside, but it's okay that we can look good on the outside?
I'm all about Botox. I feel like when you look in the mirror and you like what you see, it's gonna make you feel good. It's gonna make you happy. So I don't want to see a wrinkle on my face. I really don't. I
Absolutely.
mean, so yeah, I'm all about and fillers. That's the thing. If you go to the right person, if they suggest it, I'm all about doing that. Whatever.
Yes.
I feel like if you go to a good place and you trust them, whatever they suggest, I don't mind doing it.
Okay.
I really don't. I mean, I'd rather do everything else, but a facelift.
Okay.
So, like, I mean, I guess eventually, down the line,
Yeah.
I'll do a facelift.
Most of our clients feel the same way too.
Like,
So,
I'd rather do everything else.
Yeah.
But,
Yeah.
I really don't want to get that all done. That makes me nervous.
okay.
Do you do any like CO2 laser or Morpheus or microneedling, anything like that?
I just recently did the CO2 laser, like, but not severe.
Intense.
Yeah, not intense.
Okay.
So and it was not bad at all.
Really
Yeah.
good, right?
Yeah, no,
What
it
are
was
the
good.
results?
Like I mean, how do I look?
You look
Really good.
amazing.
Oh,
You look fabulous.
Yeah, it was just not intense.
Right.
And
Which
because
just means sometimes when it's not intense, you'll need maybe a few extra sessions if you're looking to really like tone the skin, tighten. Sometimes it's really good with lightening up pigmentation and such. So I always tell our clients too, it's okay to go lighter. You just might need an extra one or two
Right.
just to see a little more results.
I only did it one time.
Yeah.
So yeah,
Mhm.
it wasn't bad.
And then-
Yeah, and that's the thing. Like if you're scared, maybe don't go so severe.
Right.
It's
not
better. It's
necessary.
better to take baby steps instead of just
Always.
jumping in the pool.
Yeah.
Not
That's
knowing
it.
what
Yeah,
you're gonna
I
get.
agree. I agree. Very much so. I mean, there's no need to be fearful. It's
Yeah.
and again, I think you have to be in the right hands, someone who can guide you, and they're not there to just make money off of you, but there for your best interest.
Yeah, she's really good about not like raising expectations. She'll tell you what you're going to get.
As it is.
Yeah. So
You're
she won't
very
just say,
realistic.
let's do it, because you want it. No, she'll give you other options. It's really good. She's
Yeah,
very
and
good.
that's
I think
important.
It's nice.
important. Yeah.
Yeah.
If you had to pick one beauty treatment, I think you said it already, that you couldn't live without, what would that be?
Okay, for instance, give me options.
Any like you had the laser, maybe
Botox.
Botox filler,
Okay, I would say all of the above. No, again,
right? I think it's a
There
hard,
is, there
it's a
isn't
hard
the
toss up.
all of the above is choice E. You're
I
fine.
mean, I
You're
guess
good. You're good.
Botox, because again, I want to see any wrinkle.
Yeah,
I don't.
I agree.
I like a
I love
smooth
my Botox.
face.
Yes.
Yeah, I do like it.
Yeah, I use Jeuveau. I
Or
like Jeuveau a little
Jeuveau.
bit more than
Okay.
but I absolutely love it. There's nothing like it out there. So being in the public eye, we've all watched you go through so much and stay so strong. What advice would you give to women about staying strong, staying healthy, and
Men.
taking ownership for their wellness? What would you say to women out there who are struggling or
Well, I feel like women that are struggling out there, I feel like if you feel good and you look in the mirror and you like what you see, that's going to give you all the strength in the world. It really is. And if you, and try it, like work out. When you work out, I mean, it takes time. Like, it's not going to happen overnight. I would say, like, give it 3 months and then you'll start seeing results. And then you're going to absolutely be so in love with yourself and you're not going to want to stop. So you're going to want to keep doing it and going to a great wellness place that, you know, will help you feel good and like, get your blood work done
right?
and make sure that, your levels are right. Because if your levels are off, if you're not feeling right, that's that could be a reason why
Absolutely.
too.
Yeah.
Yeah.
So, and everyone goes through it at different ages,
Yes.
right? That's
Very
something
true.
like you should
Yeah.
talk about because, yeah, like if
Yeah.
I go, I might be going, I might go through it later on, but you
Yes.
might go through it earlier. Like we don't
Definitely.
know.
Yeah, and you can
So-
go on it.
and you won't know
years.
until you get blood work done.
Right. Yeah. So, and sometimes we ignore those symptoms. We think it's just, whatever, it's going to come, it's going to go away, and we ignore them and not realizing even in our late 30s that these things can start happening, menopause, perimenopause.
Yeah, you don't have to
It
be
hits us at all different ages. So.
Yeah, and I see the difference. Like, I wish, like, I lost my mom at 66, so young. So I just feel like I wish, yeah, like I don't. She never talked about any of this,
No.
and like, because I don't think it was. I don't know if it was around back then, but
Yeah.
I think it came. Yeah, I started like. Well, she died now. It was like 9 years ago.
Okay.
Because her anniversary was coming up. So I'm just now. It's like you hear about it so much
Yes,
more.
I think the past few years, it's definitely the awareness has gotten more intense. Women are just, I think, taking stride and making sure that we should be aware. We should be aware of these things, and
Yeah, and it's okay to feel better
yeah,
in a healthy fashion, right?
Yeah,
you
I-
should feel better.
Definitely.
Yeah.
I think-
Like, how long have you guys been around?
Our office has been open for 5 years, but I've been practicing emergency medicine and board certified for the last 20 years. So 20 years plus, actually. So I've probably seen 200,000 patients. So not only do I have a background in emergency medicine, so board certification and that has led me to take care of a host of diseases, illnesses, where we're just putting on band-aids and things like that. Where I've come into this practice where now I can look at a patient in a relaxed fashion, like we're doing right now, just talking, chatting, getting to know them, getting to know what's bothering them, and then be able to not fix them, but hopefully help them live longer and healthier and look better and feel better about themselves, like you're saying. So that's
preventative medicine.
exactly.
Yeah.
So
I mean, like now you're hearing about it so much more.
Yes,
Everyone
which is great.
does look so much. And they do.
Yes.
They look really good. They look
Yeah.
younger. Everyone feels good, looks good. Yeah.
Yeah.
Weight loss, I feel like, is better with people.
oh my
Yeah.
God, it's fantastic.
And then
Absolutely.
that gives you more confidence too. Like when if you're not overweight.
Yeah, I'm
I
sure
think it's a circle, right? So like you get your hormones together, you start losing weight, you want to exercise more, then you want to look good on the outside too, and it just makes you a whole person. It puts you together. So you just have to know when to take that cue of I need to start doing something, check my labs.
That's your whole concept, inside out, right?
Yeah.
We could make our bodies better from the inside and get healthier, and then all of a sudden, you really want to not only feel the part, but look the part, right?
Right.
So-
And of course, like eat what you eat and what you put in your mouth. That has a
So
lot to do
Everything.
with it also.
Oh my
like
gosh,
like you said
yes.
earlier when we were talking earlier, your gut health is so important to you.
Yes.
What you put inside you is going to make you healthy. It's going to make your brain work better. It's going to create longevity. It's going to make your immune system better. Everything stems from the gut. So
Yeah.
totally.
It's just as important as your brain health, your gut health. So I think a lot of people need to realize that too.
Yeah. And do you feel uncomfortable talking about like GLPs? Do you think it's a good thing for society to be on like a GLP-1 or something like that?
What is that?
Like Ozempic or
Oh,
or the-
listen, if it works for you, I think you should. Like if it by doing it, if it makes you feel good and then and you're happy with it, like a lot of, I think a lot of people that go on it are really happy with it.
Agreed. I've been on it for years.
Good. That's
Oh
awesome.
yeah, no, it's fantastic. It's
Yeah,
life
no.
altering.
I mean, everyone that I know that's on it is really happy with it.
I guess the last thing is what's next for you. I know you've written 7 books, 6 books. 7?
I have 4 cookbooks
4 cookbooks. I saw like a few bunch of bestsellers.
and 2 memoirs, and
Oh,
I'm
awesome.
currently my 3rd.
No, good. No, congrats. So awesome.
Exciting.
Yes,
Good,
I'm
good,
excited.
good.
I do have, I would say something that goes along with this whole wellness
Good.
field that's coming out soon, which I'm really excited about.
Congratulations.
And I can't wait to
Awesome.
let everyone know about that.
We're excited.
And I just finished filming 20-year Ultimate Girls Trip, which that, I'm not sure when it's airing yet, but yeah, we just filmed that for 2 weeks.
Well, thank you very much.
Thank you. Thanks for
Yes.
having me.
Our pleasure.
Yeah.
Yes,
And
thank you so
thanks
much.
for all the knowledge.
Absolutely. That's
Yeah.
what we're here for. It's all about
Definitely. Thank you.
educating and helping everyone to become more aware. So we're so happy that you're here with us and helping us share that.
Thank you. Thank you. Yeah, no, you guys are making everybody live longer and look better. Yeah. Dr. Rutman, I would love to try some of your peptides.
Let's go right now.
Okay.